My name is Maya. Again, I'm a MD and PhD student at Northwestern. So actually, what prompted my interest in global health, I had always been interested in medicine, but I was never really interested in global health. But the thing that prompted my interest in it was the study abroad program that I did during my global health minor. I actually went to India. So it was an unaffiliated program, but it was very inspiring to me because I learned what public health was. I had no idea what public health was. And I saw the way to combine clinical medicine, because where I was working in a NGO in Udaipur, which is the northwest part of India, and they have clinics, but they also do a lot of health education, and they use sort of top-down and bottom-up methodology to improve healthcare, especially for women and children in that area. So I kind of learned what public health was, and I just fell in love with it, especially the way to combine it with medicine. The theoretical coursework, kind of gave me some thoughts about the ethics involved with global health, the importance of sustainability, of being very community-driven and community-focused, and to not come in as a foreigner and assume you know anything, but to really take what the community is saying and use that to design interventions and to provide good clinical medicine as well as be a public health practitioner. And I think that context and that foundation has really matured. I entered an MD and PhD program, so I've learned a little bit more about those concepts. And then when I was on my Fulbright, which is a substantial amount of time abroad in a research course setting, I was able to use some of those ideas that I learned in order to do research which was really community driven. I think being able to be in India for that much time, I learned my thoughts about global health matured even more. So I was really lucky to be able to do that, and it's something I'd like to do in the future. I also think that everyone talks about how wonderful global health is, and I love global health, but it's extremely challenging as well, both in terms of making sure that what you're doing is sustainable, but also just the logistics of it, especially because I had never been away for that long, and I think that was one thing that I learned there also, was how to take care of yourself when you're abroad and make sure that you continue your interest in it, because sometimes, especially my research was on domestic violence, so I'm telling you, after 8 months I was fed up. I was sick of hearing sad stories. I missed home. I didn't want to eat Indian food ever again, and I think it's really important to remember that component of it as well, and realize that it's okay to feel that way. And now I'm re-inspired about the work I'm doing, and I want to go back.